and the Chief Medical Officer of Australia, Professor Paul Kelly. We're following up on the Prime Minister's announcement in relation to the release of the Australian Technical Advisory Group on Immunisation advice with regards to the vaccination of children 12 to 15-year-olds, as well as an update on the national rollout. In particular, the Australian Technical Advisory Group on Immunisation has considered and recommended that Pfizer be made available to all children 12 to 15 years of age. We are following their advice and following the sequencing that they have suggested, and as a consequence of that, we will open up bookings for vaccinations as of the 13th of September for all children aged 12 to 15. This builds on the fact that since August the 9th, we have opened up vaccinations for immunocompromised children, children with Indigenous heritage and children in remote communities, as well as the addition of those on the NDIS subsequently. Importantly, what that means is that we're in a position to ensure that all children and all families who seek their children to be vaccinated between the ages of 12 to 15 will be able to do so this year. We're in a position to move from the 13th on the basis of the advice, and that's a carefully sequenced plan. We're opening up, as you know, for 16 to 39-year-olds as of Monday. So that's a very important step, and some states and territories have already done that, and we thank them and recognise that, and we'll continue to work with all of the states and territories on that front. In addition to that, if the Australian Technical Advisory Group and the TGA approve the provision of Moderna for 12 to 18-year-olds, we will also make that available. These vaccines, and General Fruin will go into more detail on this, will be available through the usual channels. In particular, general practices, Aboriginal community-controlled health organisations, Commonwealth vaccination clinics, Moderna through the pharmacies, and in addition to that, as states and territories are in a position, they will make these vaccines available through both state vaccination clinics and where they choose to run school-based programs through school-based programs. So I think that's an extremely important next step in the plan and the rollout program.